Good evening and welcome to this special edition of Cronkite News on Arizona PBS. I'm Emma Vandeninde. Thank you for joining us. Tonight, we take a look back at the stories from our Washington, D.C. bureau, from how assistance programs have been struggling to keep up with rising demands, to how the Biden administration handled the vaccine rollout in its first 100 days.
Here in Arizona, COVID-19 infections appear to be leveling off last week when officials confirmed that a variant of the virus first found in the United Kingdom had been found in the state. Not good news, but experts say things could be worse, as Jake Holter reports from our Washington bureau.
There are at least 3 known cases of the UK variant of COVID-19 in Arizona, and the Arizona Department of Health Services is closely monitoring it.
So we are carefully watching the variants. We have been working with partners that have been doing sequencing around the variants of the virus. We do know that that variant appears to be easier to transmit, which could lead to a surge in cases.
It's one of at least 3 variants of the virus, including the one from South Africa. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, says this evolution of COVID-19 was not unexpected.
If the virus replicates enough, namely when there's a lot of infection in the community and in the world, you get mutations that do impact the virus's function.
Fauci says those mutations can make the virus more transmissible, more dangerous, or even resistant to antibodies and vaccines.
One was first noticed in the UK, and it's a different lineage referred to as B117. That increased the transmissibility of the virus, and just recently the British colleagues have said that it actually increases somewhat the seriousness of the infection.
But he says the UK variant is less concerning than the South African mutation, and for Arizona at least, the timing of the UK variant's appearance could help fight the spread.
If this new variant had become dominant in early January, it would have been an utter disaster because we were already headed on the upslope, and it would have made things even worse.
But Humble, the director of the Arizona Public Health Association, is cautiously optimistic.
Now we're headed on a slight downslope, and so we're in a better position to tolerate the new strain a little bit than we were, say, 3 or 4 weeks ago.
Dr. Christ, speaking at the opening of Arizona's second state-run vaccination site yesterday, said the variant also appeared after the development of effective vaccines, which could help in the fight.
That's one of the reasons we are so focused on getting the vaccine out as quickly to as many people as we can.
In the meantime, Christ repeated the all-too-familiar defenses against the virus: wear a mask, physically distance, and stay home when sick. In Washington, Jake Holter, Cronkite News.
As of today, the state has administered more than 700,000 doses of the COVID vaccine, but overall cases and deaths continue to climb, with more than 765,000 cases of COVID-19 and 13,362 deaths so far in Arizona.
Just 2 months after the first COVID-19 vaccine was administered in Arizona, the state delivered its 1 millionth dose yesterday, an important milestone. But some experts say the system for delivering those doses is not reaching the people who may need it most, as Jake Holter reports from our Washington bureau.
1 million doses in 1 million arms. But whose arms exactly?
These pods are delivering vaccine to well-off Arizonans at the expense of low-income people. And remember, low-income people have suffered the brunt of this virus from the start because they have jobs that put them in contact with the public a lot.
Arizona Public Health Association Executive Director Will Humble is not the only one concerned about who's getting the vaccine.
For me, the biggest issue is there's enormous disparities we're still seeing in who got vaccinated and who didn't get vaccinated.
Dr. George C. Benjamin, the director of the American Public Health Association, sees a structural problem with the system used to schedule a shot. For example, if you work in front of a computer all day, you have an advantage.
The person working in the grocery store, the person driving the bus, they can't do that till they get home. And that is usually after all their appointments have gone.
And Humble notes that not everyone has easy access to the internet.
Really, the only way into the system is through a computer, so you need to have a new computer, or at least a good computer. You need to have broadband, you need Wi-Fi, and you need to have the information so that you know precisely when the window of opportunity opens.
And they are not the only ones concerned. During a virtual tour Monday of the State Farm Stadium vaccination site, Vice President Kamala Harris asked Arizona Department of Health Services Director Kara Christ how the state is reaching out to the hardest hit communities.
We are looking to partner with community leaders to put community-based pods in some of those hard-to-reach and targeted zip codes, but we definitely are trying to target those populations because we know how at risk they are.
And state officials are celebrating this milestone. Chris tweeted yesterday that she was, quote-unquote, thrilled to hit 1 million doses, and Governor Doug Ducey called it a major milestone, even if there's more work to be done. In Washington, Jay Coulter, Cronkite News.
With the Senate focus on impeachment this week, the House is working out details of the Biden administration proposed $1.9 trillion COVID relief bill. It would fund everything from local governments to school safety. And as Jake Holter reports from our Washington bureau, it could put money directly in Americans' pockets if it's approved.
Andrew Shagru, the Assistant Director of Policy and Advocacy at the Arizona Center for Economic Progress, says Arizonans need that help now.
1 in 9 don't have enough to eat, 1 in 6 aren't caught up on rent, and 1 in 3 can't afford their usual household expenses. And so it's time for Congress to act on this, in order to help Arizonans on this.
Critics like Arizona Republican Representative David Schweikert say they want to get relief money out, but there's such a thing as too big and that relief needs to be more targeted.
Once again, we're going to be sending stunning amounts of money to places that it's going to just sit in a bank account. It's going to go to places where it's not actually creating that velocity, that multiplier effect of helping those who are suffering.
Opponents point out that the latest plan comes just over a month after the $900 billion COVID aid package was signed into law, and billions from that plan are still unspent. Others say the plan was too little too late, which is why the larger package is needed now. Dave Wells, the research director at the Grand Canyon Institute, says the latest stimulus could have a huge impact on Arizona.
A family of 4 is going to get $5,600 if they're below the income levels, and that's going to be a huge effect for them to be able to get themselves out of a huge holes that many of them have.
He says some people will save this money, but most will spend it, which will stimulate the economy.
But people will spend it relatively soon, and again, that's going to help Arizona businesses quite a bit. I mean, it's a big reason why the Arizona state budget is in such relatively good shape is because of all this money that's come in from the federal government this year.
Lawmakers are currently debating who should get the stimulus payments, with some saying wealthy households don't need it. But Shagru notes that some salaries have dropped sharply in the past year. The Center for Economic Progress found that 30% of households making more than $100,000 last year saw a loss of income since the pandemic began.
The risk of doing too little, it far outweighs the risk of doing too much when it comes to relief for families that have been struggling throughout the pandemic.
The House approved the Senate amended budget resolution on Friday and are working towards making the COVID relief bill go into effect by mid-March. In Washington, Jay Coulter, Cronkite News.
Nearly 1.4 million Arizonans struggle with hunger daily, and the numbers have gotten worse during the pandemic. It's something the Biden administration hopes to address with a boost in food aid. Cronkite News reporter Molly Hudson has details from our Washington bureau.
We know many families are hurting.
That shows in the rising number of Arizona families in the Supplemental Nutrition Assistance Program, says Stacy Dean, the Deputy Undersecretary over Food Programs at USDA.
About 420,000 families in Arizona are using SNAP's benefits. That's up from about 375,000 families a year ago.
That's why the Biden administration wants to boost SNAP, or food stamp benefits, by 15% through September. It also wants to continue a program that helps get food to low-income school kids who are not in school.
The proposal includes a 15% increase in SNAP benefits that would be extended through the end of September. It also includes increasing pandemic EBT benefits, which is actually a program that was created last spring to provide an EBT card to families who relied on free or reduced price school meals to purchase food when schools closed last spring.
Angie Rogers, the president and CEO of the Arizona Food Bank Network, says the second round of PEBT could reach about 630,000 school-aged Arizona children, in addition to children under 6. But Rogers wonders if it will be enough.
And the increase for SNAP benefits of 15% is really the equivalent for those children of a SNAP.
She says the increase adds up to about 90 cents more per child per day, or about $6.73 daily.
So, is that enough to feed children? Probably not, but it's getting up there. It's getting to a place where we're feeling confident that they'll be able to buy healthy, nutritious items.
And it could help the state's economy while it helps fight hunger, says Andrew Segru.
Every dollar that is issued in SNAP benefits to a family and used, it garners approximately $1.5 to $1.75 dollars in economic activity.
Experts say families spend those dollars almost immediately at local stores, helping the community and keeping food on the table for young children. Even a little bit helps, says Cynthia Zwick of the anti-poverty group Wildfire.
It's a welcome effort. I think it's something that's hugely needed here in Arizona and across the country.
Rogers welcomed the discussion about hunger, but said she hopes it continues after the pandemic. In Washington, Molly Hudson, Cronkite News.
Stacey Dean, the USDA Undersecretary, says states have been having trouble operating food assistance programs due to the pandemic. She says if you have had trouble applying for federal food programs, to please try again.
We've all seen the images, long lines of people waiting for food as COVID-19 continues to hammer the economy. But a large number of people in need may not be taking advantage of the help that's out there, a trend that continues, advocates say, despite the rising need, as Molly Hudson reports from our Washington bureau.
As many as 2 million Arizonans were eligible for food stamps in 2018, but as many as 30% of them did not access that benefit, according to a new report from the Census Bureau, a shortfall that advocates say continues today.
We definitely have seen that with folks amid COVID who may have found themselves newly unemployed, maybe not understanding that they are eligible or how to navigate the process or how to apply.
But it's not just the newly needy, says Adrienne Udarbe, the executive director of Pinnacle Prevention, a food assistance nonprofit organization. Advocates say the Supplemental Nutrition Assistance Program, or SNAP, is burdened by confusing paperwork, fear, and just a lack of knowledge about the program.
Much of what we were seeing at that time was regarding fear related to participation.
Cynthia Zwick with Wildfire AZ says the problem varies from county to county, but is felt everywhere.
For example, in Maricopa County, 26.8% of our families are eligible for SNAP, but only 67% of that population are actually enrolled in the program.
The lowest participation was in Yavapai County, where only 53.5% of those eligible got SNAP benefits, according to the Census Bureau. While workers in one benefits program often try to alert families if they're eligible for SNAP, Udarbe says that message doesn't always get through. And when it does, applicants face an intimidating application, says Ashley St. Thomas with the Arizona Food Bank Network.
It's about 50 pages. Not all of those are pages with questions, but that's kind of daunting.
And the application gets personal, Udarbe says.
You are sharing a lot of deep personal information when you are applying to participate in the program. And it can be an overwhelming process, and just the amount of paperwork and the amount of details that you have to provide.
She says a level of detail could be scaring off new applicants worried about the Trump administration's public charge rule, which could deny benefits to a household if one person is undocumented.
The language around the public charge definitely instilled a sense of fear as to if they were to participate, even if they were eligible, that it could potentially threaten the status of other members of their household as well, too.
St. Thomas says she has seen many Arizona Food Bank clients who are struggling to put food on the table but still don't apply for SNAP.
I think there's a misunderstanding of how the program works, which makes sense because they say they don't want to take it away from another family who might need it more.
Zwick says she hopes to see more families take advantage of SNAP during the pandemic. Udarbe says the government bears some responsibility for the shortfall.
The access to food is a fundamental human right, and we should try to, as a collective whole, be making it, not have folks have to jump through so many hoops, just trying to get fed.
Advocates say the SNAP program has many barriers preventing those eligible to take advantage of the benefits. In Washington, Molly Hudson, Cronkite News.
In one of his first executive orders after taking office, President Joe Biden directed the Department of Agriculture to look at ways to improve delivery of SNAP benefits, and he called on Congress to extend a 15% COVID-related increase in the amount of assistance to families.
It was just over a year ago that Congress was wrapping up the impeachment trial of President Donald Trump, with an acquittal by the Senate. Now, a historical first, A second Trump impeachment is underway. But like so much else over the past year, the scene this week is a lot different. No crowds allowed, as Molly Hudson reports from our Washington bureau.
This was the scene just over a year ago when crowds gathered outside the Capitol to protest the first impeachment trial of President Donald Trump. But ever since a mob stormed the Capitol on January 6th, Capitol Hill has been surrounded by razor wire, and the only people here are National Guard troops and Capitol Police.
I think right now, it's so secure there. They have so much security around there with the fence, the Capitol Police, the National Guard, that there just isn't, nobody's going to try to approach the place right now.
Colby, who represented southeastern Arizona in Congress for 22 years, says impeachments get a lot of voters angry on both sides, but they don't always draw crowds, at least not during the 1998 impeachment of President Bill Clinton.
There was virtually none at that time. We got phone calls. We had phone calls in the office.
Crowds would be hard-pressed to show up today, Colby says.
I just don't think it's going to be very possible. I don't think anybody has the desire to do it. They did their protesting, and it was a horrific experience for everybody.
And he's not sure protesters are likely to return after the chaos of January 6th.
And I think those opposed to the impeachment, those that were on Trump's side, kind of exhausted their bile, if you will.
Inside the Capitol, meanwhile, House prosecutors made opening statements today to senators who voted 56 to 44 yesterday to let the trial proceed, rejecting arguments that a former president cannot be impeached.
The Senate needs to be listening to the testimony very carefully, and they need to decide.
But with 60 votes needed from an evenly divided Senate, Colby thinks the outcome may already be known.
We'll see what happens, but it does not appear that there are going to be the votes to convict the president and bar him from future office.
The trial started on Tuesday and is expected to last through at least next week. In Washington, Molly Hudson, Cronkite News.
Arizona Senator Kristen Sinema and Mark Kelly were among the 56 senators who voted yesterday to let the impeachment trial go forward.
That's it for this special edition of Cronkite News Tonight. Thanks for joining us. Stay tuned for Break It Down next.
Cronkite News provides students at ASU's Walter Cronkite School of Journalism with the opportunity to gain real-world experience in the newsroom. At Cronkite News, our students produce professional content for audiences by taking on all roles, whether they be reporting, anchoring, producing, or studio production. Each department gives students first-hand professional newsroom experience. For more information, visit cronkitenews.azpbs.org.